right, welcome back. May is Stroke Awareness Month, a critical time to learn how to spot and respond to strokes, which according to the CDC strikes every 40 seconds in the United States. So joining me this morning is Dr. Juan Gomez, Director of Neurointerventional Radiology and the Stroke Program at Jupiter Medical Center. Thank you so much for being with us. A stroke, it can happen, and it could happen in front of your face and you may not even know it. So most importantly, what are the signs of a stroke?
Thank you for having me.
Of course.
And what is crucial to know is that stroke is a global pandemic and it can affect anyone. As you said it before, there's a stroke in the United States every 40 seconds.
It's crazy.
One of the leading causes of disability and the fifth cause of mortality. So it's very important to know what the signs and symptoms of stroke are. The easiest way to remember is the acronym BFAST, which is an acronym used by American Heart Association. B stands for balance loss, E for eye deviation, F for facial paralysis, A for arm or leg weakness, S for slurred speech, and T to remember that it's time to call 911.
You notice one of those things, just one of them, and it might be time. And talk about why time is of the essence with the stroke.
So every second counts, there are two types of strokes. One is going to be an ischemic stroke where there is a blockage of the blood vessels supplying the brain. Therefore, there's not enough oxygen and nutrients, which leads to cell death. The second, this is the most common one, about 80% of them. The second one, less common, is the hemorrhagic stroke, where there's going to be a bleed in the brain, pushing on vital structures, leading to cell death. So every second is of essence, because every second that the blood is not receiving its nutrients, its oxygen, it's leading the patient to more permanent damage.
And so, so people out there saying, okay, what can I do right now to protect myself, to make sure that I'm the healthiest I can be to prevent a stroke? What are the causes of these?
So just like vascular disease affecting any vessels in the body, the heart vessels, abdominal vessels, leg vessels, is a generic vascular disease. And the risk factors are always going to be the same ones. There's going to be the three bad H's, as I call them: hypertension, hyperglycemia or diabetes, hypercholesterolemia. So those are the main or most important medical risk factors. When it comes from a lifestyle perspective: binge drinking, cigarette smoking, obesity, and sedentarism. That's why the American Heart Association will recommend doing 30 minutes of exercise at least 5 times a week.
I've had the pleasure of touring Jupiter Medical Center stroke facility. What makes it so unique?
Okay. So we are a state-of-the-art facility when it comes to diagnosing, management, and treatment of stroke. We have the latest technology, including an artificial intelligence software, which can read the data as the patients are getting scanned as soon as they come into the emergency room. It can process that data and alert the whole team when there is a stroke within seconds.
That's amazing.
And again, time is of essence. But I think more important than the technology is the staff. Okay, the commitment and the passion that our staff has. This includes our techs, our nurses, our transporters, our physicians. Everybody is extremely committed and passionate about stroke.
Yeah, thank you so much. We're grateful we have you here to help treat these patients in a matter of time. And of course, it could be you out there with a loved one spotting these symptoms we talked about. BFAST, right?
That's correct.
BFAST, remember that. And if you'd like to maybe print that out, go check it out again. We put it on our website, WPBF.com.